You are in the COVID-19 info session for on-campus students. My name is Amy Shaman, and I'm providing a little tech support tonight. We will be beginning in about a minute or two. We had some feedback from a previous session that people wish we had waited until about 6:01, 6:02 to get started. So thanks for being here. We look forward to answering your questions and having you ask us some more. And we will begin shortly. Thank you. Good evening and welcome, everyone. My name is Amy Shaman. I am providing technical support for us this evening. Should you wish to use the closed captioning, we do have live closed captioning tonight. The way to see the captions is to go to the bottom right corner of your screen where live captioning is available. In the bottom right corner of the window, there should be a continue button. The button will say continue, and if you click that continue button, you will be able to see the closed captions. I'm putting into the chat box as well my cell phone number. If you do have a text issue, you may text me and I'll give it for those who are looking at the captions and not the chat. That is 513-910-9436. You're welcome to submit questions in the Q&A box. We will answer as we can during the session, and any questions that are left over will be collected and given to Dr. Brownell for her and Dr. Osborne to answer afterwards. We're happy you're here, and I turn things over to Drs. Brownell and Osborne. Thank you.
Thank you, Amy. Hi, everybody. I'm so glad that you're joining us tonight. I understand we have over 300 people registered for tonight's session, which is fantastic. So this is our on-campus COVID information session. I'm Jayne Brownell. I'm Vice President for Student Life, and I've been at Miami about 6.5 years now. And this certainly is a time unlike any other we've ever seen. And so we want to be sure that you have as much information as possible. Dr. Osborne, do you want to introduce yourself?
Hey everyone, thanks for joining us. So I'm Jason Osborne. I am the Provost of Miami University, and I've been here exactly 1 year. So I'm still a little new, but learning quickly. Look forward to talking with you throughout the hour.
Okay. So we have a lot of material to cover tonight. We have done a couple of these sessions now, so we have been collecting questions to get a sense of the things that you're interested in. So rather than answering specific questions, we're doing it by theme and weaving in the topics that you're interested in. For this session tonight, looking at the questions that were submitted, it looks like you have a lot of interest in what is it like to live in the halls, dining, activities on campus, and especially activities for first-year students. So I'm going to move through some of the things a little bit more quickly so that we are sure that we have ample time to get to those topics in this hour. I will touch on the decision making of how we got here. I'm going to walk you through what the attendance options are that you have so that we're sure that you fully understand what your options are. Dr. Osborne will go through and answer some of the academically based questions, and then we'll go through the parts of the topics that are covered on the Healthy Together site. So how to keep yourself healthy and our community healthy. While there's a lot of information on there, it is always easier when we could talk through more of the details together, and then we'll do a little bit of time of looking ahead. So first, how did we get to this decision to move remotely? I will start by saying it was a very, very hard decision, one that we were hesitant to make, that we didn't want to make, but as we looked, the most important thing that we had to ask ourselves was, Did we feel like it was safe to bring 20,000 students back to the small town of Oxford in the month of August with everything happening around the country? So unlike other Ohio schools, we have 40% of our students, more than 40%, come from all over the country. So as we are watching that this pandemic is still growing in many ways, that there are more hotspots popping up instead of less, that Butler County here in Ohio was at the third of four advisory levels for a couple of weeks. Looking at the availability of testing, we said it didn't feel safe. It didn't feel time. So we took the recommendation of Governor DeWine, who recommended that all Ohio schools use a phased-in approach to returning to campus. So our first phase was this summer. We had a number of student athletes coming to campus to prepare for their fall sports. We've been able to test some of our protocols, to test our communication, and we've been able to make some adjustments. Our next phase is that we know a lot of our off-campus students have leases that start in early August, and they are telling us they're coming back to Oxford, whether classes begin together or not. So this is going to be a much larger test for us of, are we going to be able to get it together? Are we in Oxford going to be able to do what we need to do to contain the spread of COVID? There is no question COVID will be here this fall. It will be in Oxford, it will be on campus, just as it is all over the country. So our challenge is, how do we provide education to students so that you could reduce your risk as much as possible, make good choices, then have early identification of cases and contain it. So that is our plan moving forward. So with all of that in mind, we are giving 3 attendance options for you to choose from. All of our students, all of our undergraduate students at Oxford have the same basic 3 options. The first is that you will start your classes remotely. No matter the modality, you're going to start all of your classes remotely on August 17th. Then any classes that have a designation of face-to-face will start in person on September 21st. So that is, you are going to return to Oxford, whether on campus or off campus, for a face-to-face physical presence in Oxford. Option 2 is to stay at home, to select all remote courses, either online or hybrid, and do your entire semester from home. This is not intended for people who are going to return to Oxford and do online courses, and we'll talk more about that very briefly, knowing that this is an on-campus session. And then your third option is either as a new student to defer your admission, or as a continuing student to take a leave of absence, if that is the best decision for you during this pandemic. So let's walk through these a little bit more. I'm going to assume that nearly everyone on this call is a first year or sophomore living on campus. So if you want more information about off-campus students, or if you were a junior or senior and have that need, we did do a session yesterday that was recorded and will be available tonight. So I'm going to focus on first years and sophomores, knowing there may be a few juniors or seniors that live on campus. Really, it's the same information for you. So as a first-year student, option 1 looks like beginning your classes remotely. You remain at home until you move into your residence halls the week of September 14th, and then you start any face-to-face classes on September 21st. Option 2, stay home all semester. Adjust your schedule so that you're taking a mixture of online and hybrid courses that are appropriate to be fully online for your whole semester. And then we talked about number 3 is to defer or take a leave of absence. I'm sorry, to defer as a first-year student. As a sophomore, same 3 options, but that option 1 has 2 branches. So you can either be just like what the first-year option was, start your classes remotely, stay at home, move into the residence halls the week of September 14th, and then start your classes online. Sophomores for this year only are, however, being given the option to cancel your housing contract and secure off-campus housing. So this is a way for us to de-densify our residence halls, to be able to spread out a little bit more. So in that case, you would still choose option 1, but you would begin your classes remotely. In addition to telling us that you're going to be choosing option 1, you would also cancel your housing contract. You'll stay at home for that first month of school and move into your off-campus housing the week of September 14th to start your face-to-face classes September 21st. And then option 2 and option 3 look exactly like what we just talked about. I'm going to skip by the junior and senior options for the purpose of the session. So to think about considerations of these options that you could choose from. If you choose option 1, first month of the term while you're at home taking classes remotely, remote tutoring will be available. You can participate in telecounseling if you are physically located in the state of Ohio. There are licensing requirements for counselors that they can only counsel students or people who are physically located in the same state they are. So you have to be physically located in Ohio to do telecounseling. However, we do have other supports for mental health that I'll talk about later. If you are a student with a disability, you could receive assistance from the Miller Center for Academic Accommodations. And we will have events and student organization activities that you will be able to participate in while you're remote. All our offices will open with limited services starting August 17th. So we are all going to be back on campus. It may not look exactly like it did before. So if you do end up staying with someone for a couple of weeks earlier, that kind of thing, you'll see that Armstrong Student Center is going to be 8 a.m. to 8 p.m. for that month instead of staying open until midnight or 2. So we will have things open, but more limited. All campus resources will open fully beginning September 14th in time for first year and sophomore students to move into the residence halls that week. So option 1 students can either live on campus or off campus. In recognition that that first month of school, we will not have things open as fully or as broadly as we normally would. We are doing a reduction in the fees that you pay to support those services of $750. I remind you that if you are a first-year student, you must live on campus. Only sophomores, juniors, and seniors with housing contracts are being released from those obligations, and it's a separate process than choosing option 1. In thinking about option 2, if you go fully remote, you will still have access to those same services remotely. There are some people on Facebook who were talking about, as a first-year student, getting an apartment off campus and choosing option 2. I want to remind you, option 2 is to stay home. And first-year students are not being released from the housing requirement that they live on campus for 2 years. So if you were to rent an apartment for the year, in the spring, hopefully we're all going to be back together, you would be required to live in housing in the spring of your first year and all of your sophomore year. So please keep that in mind if you are weighing those options. Also know that if you are a remote student, since we are working under the understanding that you will not be present in Oxford, there are a number of services that will not be available, including use of the recreation centers, reserving rooms in Armstrong or in the student center or in the libraries, using student health services, campus transportation or parking. You wouldn't have access to on-campus dining. And I'm going to get into talking about quarantine and isolation quite a bit later. If you are in option 2, you would not have access to use our on-campus quarantine or isolation spaces, since we need to reserve those for the people in residence. And you also can't be employed on campus if you choose option 2. Recognizing that you would not be using any of these services, we're reducing the fees for Ohio students by $1,000 and out-of-state students for by $2,000. If you decide that you want to take off, that you just want to sit this one out and wait for the world to level out again, you may have some health concerns or other things that you want to put off your return. As a first-year student, we will hold your admission spot either until spring 2021 or fall 2021 with your scholarship offer intact. Continuing students, for our sophomores, juniors, and seniors on the call, if you take a leave of absence and you have taken out any student loans, please be sure to read the FAQs on our Healthy Together site and check in with financial aid, because there are some things you need to be aware of how that affects student loans moving forward. So, Osborne, I'm going to let you add anything else you might want to about what we just talked about, and have you jump right into the academic issues.
Yeah, you just caught me. I was trying to finish answering a question there. So I want to echo one thing that Dr. Brownell said early on, and that is that our faculty and staff have devoted their entire careers to the pursuit of higher education and to students. And so I don't want you to be under the impression that we don't want you back on campus. We are absolutely eager to have you back when it is safe to do so. And so none of us want this. All of us are looking forward to getting past these health concerns. And I just ask that you keep that in mind as we move forward. No one's enjoying this. So let's go ahead and flip to the next slide there, I think. Okay. So one of the questions that popped up in the chat was about face-to-face and online. And so let me just take a minute to go through the difference between all of the different class modalities we have. And I want to start by saying that our faculty have been in summer school since May. We've had over 500 faculty out of a faculty of 900 who have engaged in some training for online and hybrid classes on new and innovative teaching techniques to prepare for this moment where we're going to welcome you to the semester, regardless of how we welcome you. And we were all looking forward to an on-campus experience. So obviously we're disappointed at this point, but I want you to be reassured that our faculty take the most pride in the educational experience and the engagement with our students. So the Miami quality of the classes will not differ from a face-to-face experience, a hybrid experience, or an online experience. And in fact, in some cases, we can use very interesting and innovative teaching techniques in hybrid and online spaces that may actually make them, in some cases, more engaging. So, so I want you to start with that. Now, when you see face-to-face, when you see hybrid, when you see online, what those are technical definitions, and face-to-face means that the class has been scheduled and planned for in such a way that everyone in the class would be present in the same room with the instructor on campus for every class experience throughout the entire semester. That's what we think of as a typical college course. Online refers to the fact that the class was planned in such a way that we would never be in the same room, that it would be an online or remote experience. And there are two different types of online, large groups of online experiences. One is a synchronous experience. So if you're looking at your class schedule and you see a class that's designated as online and it has a time and a day, like Tuesday, Thursday, 9:30 to 11, that's a synchronous experience. And what that means is that everyone is remote, but they're on at the same time. And they're like we are right now, we're in a synchronous environment. An asynchronous environment would not have a specific time. And those are set up more to be self-paced experiences where you can move at your own pace, at your own time. There's no specific class meeting. Those can also be very engaging if they're done well. And then there's hybrid. Hybrid is anything that's not one of the other two. So if it can range from mostly online with a little bit of face-to-face to mostly face-to-face with a little bit of online. And there are a lot of very interesting teaching techniques in that space, and there's a lot of diversity. So one of the nuances here that we're helping students navigate is if you want to choose option 2 and be remote, not come to campus for the entire semester, you have to choose either online courses of either type, asynchronous or synchronous, or a hybrid course that allows you to be fully remote through the entire semester and be successful. So the hybrid is a little bit of a weird space because you're going to have to talk to the instructor, to your faculty member. You're going to have to say, I'm wondering if I can complete this course successfully from my home rather than being present on campus. And the instructor, depending on the teaching technique and the plans that they have for that class, will either say yes or no. And that's really the only way to navigate that. There is no option where you can successfully complete a face-to-face course while being fully remote for the semester. Now, obviously, during the first 5 weeks, any course that was planned to be face-to-face or hybrid will be fully remote. But after that, fingers crossed, everyone will be back on campus. So, so what will that look like? What that looks like is we have a lot of faculty who are preparing now to do this different first 5-week semester, and they are preparing to do the best they can given this unexpected event. And then they're also simultaneously planning for whatever was supposed to happen after the next 5 weeks. When we're talking about the choice between option 1, option 1ABC, option 2, option 3, all of those things, the dollar discount is something, or the refund, whatever we're going to call it, is something that where there's also confusion. And so one of the things I want us to help understand is that there is no different tuition regardless of what you choose in terms of if you come to campus, if you're going to be fully online. Obviously, if you're going to sit out the semester or the year, that's a different situation. But the tuition is the tuition because we are delivering the academic enterprise regardless of whether we're in person on campus or remote. And in fact, it costs us more to do remote and online, which is not what a lot of folks think about. So the discount refers to what Dr. Brownell was talking about, the fact that we acknowledge that the on-campus experience will be limited. You won't have access to many services for the first 5 weeks. And then after that, hopefully you will. And so that's the difference between all the between the $750 and then the $1,000 or $2,000 is that access to services and fees that you pay specific fees for specific services. And if you can't have those services, then we refund the money. So, so moving along, there are certain things that are going to be happening on campus that will be designed to support the success of the students and the faculty and staff as we move forward. For the students, one of the things that we started in the spring is we have a policy of credit, no credit, where students in the first few weeks of any semester can choose to take a course that's not required for their major and not, and typically not an honors course. You can take that credit, no credit. What that means is that if you get a passing grade, you get credit, and that goes in your transcript as credit. And if you don't, then you don't get credit, period. And that's different than pass-fail. So there has been some confusion around that. Pass-fail, in our opinion, is less desirable than credit, no credit, because similarly, if you pass the course, you get a pass. But if you fail the course, then the failure goes on the transcript and hurts your GPA. You get a 0 that's figured into your GPA, whereas with no credit, you just don't get credit for the course. And so typically you can do that any semester. In the spring, we revised that policy to allow you to elect that option anytime before classes end. And for the fall, because everything is so up in the air, we're going to do that again. So you can, at any time during the semester, say, for this course, I want to take it credit, no credit. and then that's what will happen. And the other modification we're making to be more supportive for students is that we're not restricting that election to only non-major courses. So you can take that for any course, and it won't harm your progress toward degree. We are advising that if you do that, especially if you're new to the university as a first-year student, that you should probably talk to an advisor to make sure that there isn't something that would hinder your progress. But this is something that is in your control. There are going to be some things that will be available. If you have to be in a research lab, if you have to have access to certain things, and you're going to be on campus, those types of services will be available once we're back on campus. The other thing that some folks have had some concerns about is the sequencing of required courses. And so if you take, if you're required to take a sequence of 2 or 3 courses, you can't see what's coming in the spring. And so we've gotten a lot of questions about how will you know if you take, the first calculus course, that the second calculus course will be available for you. And what I want to do is reassure you that when we are scheduling courses, we always prioritize required courses, and we're always looking at pathways through degrees and trying to figure out where there's demand that's not being met. And so the courses that are not required, we try to offer as many of those as possible because that's what separates Miami from other universities. But the required courses are always available if you need them. And finally, study spaces are going to be available if you're on campus. You can sign up for a study space in the library. There are study spaces throughout campus. And we will also have academic buildings open during certain hours where, if you just need a place that's quiet, where you can study, where you can participate in an online or remote class, you can do that as well. The other thing that has come up is concern over move-in. So if you're planning to move in between September 17th or 14th and the 19th or 20th, how will you navigate that if you're currently taking classes remotely? And so we've been talking with our faculty certainly about that, and they are aware of that issue, and that will certainly be a complicated week, especially if you're coming from out of state. And so we're encouraging faculty to be very aware of that and to have opportunities where if you're in a synchronous online class, that you have assignments or other activities you can do on your own time so that you're not running into trouble there. I think I'll stop there and turn it back over to Dr. Brownell and see what other questions are popping up.
Great, thank you. All right, so we are going to spend the second half of the session jumping into things more related to health and precautions that we are taking and need you to take to be able to come back to campus. Everyone who is selecting option 1 needs to agree to be able to do these things moving forward together. So we'll talk about that at the end. But there are a lot of steps. We are taking our guidance from the Department of Health, both in Butler County and the state of Ohio, the CDC guidelines. We also have a really amazing partnership with TriHealth, who runs our student health service, as well as our local hospital in town, McCullough Hyde. They are the largest health system in Cincinnati, and we're really fortunate to have this partnership with them. So working together in partnership with all of these people across the state, we have a number of requirements and precautions for you to think about. So the first is, of course, you need to practice physical distancing. This is something you've been hearing a lot about. Hopefully this is already becoming habit for you. Physical distancing we use that term very intentionally instead of social distancing. We do not want you to be socially distant. We believe in community. We believe in connection. That is very important. We want you to be socially connected in a physically distanced way. Face coverings are going to be essential. So you will be required to wear some kind of a face covering. That could be a mask, that could be a bandana or a neck gaiter, whatever you're more comfortable with, but required in all buildings on campus. as well as when you're outside and it's difficult to physically distance. So as you're coming in and out of buildings or you're on a crowded sidewalk, hopefully you'll be wearing one routinely, unless you are alone in your residence hall room, you're using the bathroom, or you're eating. You should be covering your face. You will not be allowed to enter a classroom, to be served in a dining hall, or to be helped in an office unless you do use a mask or some other face covering. So unless you have a medical exemption that you could get through the Miller Center for Student Disability Services, that would be required. We think about how we want to try to identify illness early. We are asking every member of our community, faculty, staff, and students, that every morning you do a daily symptom assessment. So you're going to take your temperature, you're going to look at a list of symptoms about COVID, and if you have any of the symptoms, you're going to stay home. You're not going to go to class, you're not going to go to an on-campus job. You're going to call your doctor, you're going to call Student Health Services or your private doctor and have a conversation about, here are my symptoms, is this likely to be COVID, and should I be tested? Now, not every symptom is going to be able to be assumed to be COVID. So for instance, I have a chronic cough. I cough every day. So when I look at the list of symptoms, I'm not going to call my doctor every day because I'm coughing. You're looking at, you know, when you feel well or when you don't feel well, and you're looking at that. So when you call Student Health Services, they're going to tell you whether to come in to be tested or not. If you were going to be tested, we ask that you prepare a go bag. This may even be something that you want to have with you when you go, because there is a chance that we're going to have you quarantine straight from Student Health Services, and I'm going to talk about that more. It means that if you need to go into quarantine, you're going to need 2 weeks of supplies, clothing, toiletries, your books, other kinds of things that you're going to want to have a go bag ready to go so that you are going to do what you need to do after you are tested. So testing is one of the things I get the most questions about. It is one of the areas that we certainly talk the most about because the science is changing all the time, and requirements and recommendations are changing all the time. Talking to the director of infectious health for Tri-Health, talking to our faculty members who are public health experts, that is their field, to the Department of Health, to the requirements that are being put in place for Ohio public schools. Right now, as of today, we are not requiring that you be tested before you arrive on campus, because that is one point in time. It really will not tell us much about whether you have COVID or not, because if you're exposed to COVID, it can take 14 days, not only to develop symptoms, but perhaps to also have a positive test. It is possible that you could be exposed, have a test on day 5 or 7 or 12 and get a negative test and still end up with symptoms and COVID at day 14. So when you look at some other schools, there is a school in Indiana that's being very public about all of this. They're requiring a positive test between August 1st and 24th. A negative test on the 2nd is not going to tell you anything about where you are on the 24th. That the minute you leave that testing facility, you could be exposed. So we are not going to do that entry testing. We are going to save our testing, and we are going to make that widely available to anybody who is symptomatic. So you can get a test at Student Health Services if you're symptomatic. We are also, though, going to continue to look at science. We have this testing group with all of these experts that are meeting weekly, and they're looking to see what is availability of testing, how fast is the turnaround time, where will the testing help us with our health outcomes, rather than just making people feel better that we're doing testing. And as science comes along, we will adapt our protocols as it makes sense to. So right now, it's symptomatic testing. So let's say that you come to Student Health Services, they recommend a test. They will either say that you are a presumptive positive, that it's a pretty, sorry, see, there's the cough, it is pretty obvious that it is more likely than not that you have COVID and it's a presumptive positive, or you're going to wait for a test. They're going to reach out to the Butler County Department of Health, and it is the Department of Health that manages contact tracing, not Miami. So they're going to try to they'll work with you to try to identify all of your close contacts. These are not all of your contacts. These are the people that you have spent some significant time with. So this is why I'm asking you that when you are at a student organization meeting, if it's in person, you have an attendance list, or faculty have an attendance list, that you sit near the same people again and again in class, so that you are keeping your circle small. And those are the people, your roommate, your closest contacts, romantic partners, that would be contact traced. If you are ill or you are close contact, you will then be required to either quarantine or isolate. Quarantine is for non-symptomatic people with exposure, so you're not sick, but you've been potentially exposed. Isolation is for people who are ill. So they're in separate spaces because quarantine, you may or may not be ill. You have to stay in quarantine or isolation for 14 days. It is a full 14 days. That means that you will be moved to another on-campus location where you will have a private bedroom and bathroom. And that's where you have to stay. If you are well enough, you could still participate in your classes remotely from that location. We'll check on you both in terms of your physical health and your mental well-being. We will provide food for you from dining, because you can't leave your room to go get something to eat, even if you wear a mask. You can't go out to get exercise. Quarantine is you are in that space. For that reason, and because we don't have unlimited quarantine space, if you have the option to quarantine at your permanent address, to go home to your family and quarantine there, that is going to be our first preference. If that's not an option, we would move you to an on-campus space. So 2 possibilities if you're in quarantine. Let's say that you were a close contact to someone that was waiting on a test result. If their test result comes back negative, you're clear, you can be released. Otherwise, as I explained, 14 days of quarantine. This is how you keep a pandemic under control. So we are taking this very seriously. We are going to make sure that you are well taken care of, but this is how we keep our community safe. Now, I talked about earlier that, so we have an active counseling center, we have in-person appointments, we have telecounseling appointments if you're located in Ohio. Even if you're on campus, you may feel more comfortable with telecounseling, that's fine too. We also have a 24-hour line that we call the Hope Line, that you could use between appointments or overnight. And we also have campus cares, which is if you just want a consultation with a counselor without an ongoing appointment, it's a way for you to touch base with the counselor. So we know that all of this is very hard. You have gone through so many adjustments and are continuing to. This is not the college experience that you were hoping for or signed up for. And so we want to make sure that you are getting all the support that you need. A lot of questions about cleaning protocols. We are going to be cleaning all common areas, both in residence halls and classrooms, on a more frequent schedule. So once or more a day. It does mean you are responsible for your own private spaces. So you will clean your own residence hall room. Our custodial staff will do all doorknobs, kitchens and bathrooms and stairwell railings and all of the high touch commonly used areas. In classrooms, though, they're not going to be able to get in between every classroom. So you have a responsibility as well, not only to clean your common areas, to clean your private areas, but to clean common areas when you use them. So we will have cleaning supplies available in classrooms that you're going to wipe down your desk when you walk into a classroom and before you leave, just like you do a piece of equipment when you go use it at the gym. Or if you use a kitchen in the dining hall, you're going to clean up after yourself more. We know you always would. Now you're just going to do a little even more thorough job. So the community pledge, if you are doing option 1, you are required to sign this pledge. What this pledge is acknowledging all of the things that we just talked about. That yes, you will physically distance yourself from other people, that you will wear a mask when you're around other people, that you're going to do your symptom assessment, you'll participate in testing, contact tracing, and quarantine if required to by the Department of Health, that you're going to be aware and that you're taking responsibility for your community. So there should be no surprises in there. We are getting questions about the flu shot. The reason that we are requiring a flu shot, unless you have a medical exemption to get one, is flu symptoms look a lot like COVID symptoms. So there are 2 things. One is we don't want to wonder if we need to quarantine because you have the flu, because those symptoms are going to look similar. So if we can rule out as much flu on campus as possible, it is going to take that out of the equation to wonder about COVID. The other thing is you can get both, and boy, you would be really, really ill then. So we just want to make sure that we're using precaution. We are going to enforce those rules. So if you are flagrantly violating any of these requirements, you can be held responsible under our Code of Student Conduct, and that is true on or off campus. So the city of Oxford is taking this incredibly seriously as well, because you are not alone here. You are part of a community. While young people generally are not seeing the same seriousness of effect of illness if they get it, you have people here who are making it possible for you to be here. You have your faculty who are teaching you, you have the people serving you in the dining halls, and there's a full community in Oxford itself who all need to stay healthy. So if you are violating policy off campus, you can be cited by the Oxford Police Department. They will let Miami know, and you would be held responsible through Miami as well. So thinking of our community is an incredibly important word to us. As we think about what makes Miami, Miami, what is the hallmark of coming to our institution versus other institutions? The thing that we think about beyond your experience in the classroom and what you're learning is that we are a close-knit community, that connections are incredibly important, and that the relationships that you build with each other and with faculty and staff as mentors are the hallmark of the Miami experience, and we are not going to let that go. That is so important. We are not going to lose that. So we're giving a lot of thought of how we support community and make sure that you are connected. So let's talk about move-in quickly. We'll get that part done, and then I can really get into what life will look like. So moving in, there will be the opportunity to drop off your belongings on September 12th or 13th. So you can drop off your belongings, set up your room, and go home for the week, or go home for a few days if you would like to. So that is an option. And then you would come back the next weekend on the 20th to be able to start classes on the 21st. Or you have been assigned a time to move in. I believe what they did was basically if you were going to be the Monday in August, you're now that Monday in September. However, we know that you're in classes. And Dr. Osborne talked about this. Faculty are going to do their best to be flexible. But what you should do is as soon as you get all of your syllabi, when you start your classes, you're going to get a roadmap of what is going to happen each week. When are your exams? When are your papers? What do you do? Look and see what you have going on that week. And it might be that Thursday you have an exam and you're supposed to move in on Wednesday. So you're going to reach out to us and you're going to say that you need a different day. That's great. Or we know it's Rosh Hashanah that weekend. So you may be scheduled to move in Saturday. You're going to let us know that's not going to work for you because you're celebrating your holiday and you need to move in earlier in the week. So this is the way that this works. We've given you days so that we could spread out our move and people could stay physically distant as much as possible during that move. If you want to arrive later than your assigned date, just drop us an email and let us know what day to expect you. It's automatic, that's fine. If you'd like to move in earlier than your assigned date, then you need to put in a request for an early move just so that we could keep track, because we just want to make sure that we're not going to have all 8,000 people moving in on Monday. We're not geared up for that yet. So we will be flexible on move-in. While I said that we're not doing testing upon entry, there are questions right now about quarantine upon entry. So there are states that the governor in Ohio is recommending that if you are coming from one of those states, that you quarantine for 2 weeks when you arrive. It is a recommendation right now. It's not a requirement. So we are not requiring it. What we're going to ask of you is that for the 2 weeks prior to moving in, that you limit your interaction as much as possible, that you self-quarantine at home so that you don't unknowingly bring COVID with you when you arrive. However, our governor may change that recommendation to a requirement, and if so, we may have to adjust as well. But right now, we're asking you to take care of that on your own. We're also asking that your entire party that is helping you move in, which we are hoping you keep small, that you are all doing a symptom check that day. And if anybody has any COVID symptoms or if you feel ill, move in a different day. Don't come to campus that day. Know that when you arrive, we're going to have people there from TriHealth and they're going to take your temperature, everyone in your party. And if anyone in your party has a fever of 100.4 or higher, your party will not be permitted to go into the halls that day. So kind of that headache before you arrive, do your symptom check so that it's not being done when you get here. So what life in the hall is going to be like? Here's the way that I like to think about risk reduction. Think about it as concentric circles. So your small circle is you and your roommate. And your family unit while you're at school. So you're going to be responsible for each other. You're going to do everything that you need to keep yourself safe, just like you would your family at home. Now, you may not know your roommate well. You may not know them at all. You may decide you don't always like each other. You don't always love everyone in your family every minute of the day. You love them all. You don't like them all every minute of the day. You still do everything you need to keep them healthy. So you are responsible for each other. More than any other year, you're going to need to sit down and agree together how you're going to run your room, because you're not going to wear masks when you're together in your room, and you're going to have to trust each other that you're going to keep each other well. That means you agree how much interaction you're going to have with other people, how you're going to do visitors and guests, all of those things, because you're your unit. So you keep each other safe. And your floor is the next level of the concentric circle. You may want to start wearing your mask there as you're on your corridor. Or because you're going to have your first hall meeting and you're going to talk about what is our comfort level. How much are we going to stay close to each other? Some of you may know each other really well and you're going to have a little bit larger pod. Others are going to say, we're all wearing our masks everywhere we go because we don't know each other that well. Go to your building. Your building thing, you're taking more precautions. You're now wearing your face covering everywhere you go in the building. You're limiting how many people are in the laundry room at the same time. You're keeping your physical distance in common areas. It doesn't mean that you can't use these spaces, but you are going to have reduced capacity in these spaces. As there will be all over, we have limited spaces to 50% or less capacity. So you may have a study room where you can only be by yourself instead of being with 3 other people. Or it may be one person in the kitchen at a time, but it doesn't mean that you are not using your space. You move outside of your residence hall, suddenly your concentric circle is much bigger. Now it's with your class, it's with your student organization, and when you go into Oxford, it's even bigger. So you need to keep in mind the risk that you are putting yourself at, but also the risk that you are having for other people around you. Know that in Ohio, right now, the guideline is no gatherings are permitted of more than 10 people. Unless you are throwing a wedding or a funeral, your limit is 10 people. That's indoors or outdoors. So all of our student organizations are aware of this. We have very detailed organization information on our website. We've been meeting with student leaders. So what a program may look like, we're still going to have lots of programs. We're still going to have lots of ways for you to connect. But it may be that we do a yoga night with an instructor and 9 people in the room. And then we're going to put that on Zoom. And every corridor or every building is also going to be watching. And they'll have 10 people in their lounge doing the same thing at the same time. What I'm essentially saying is you are still going to have community, you're still going to have connection. What we are asking is that for this semester, your community is smaller, that your residence hall is going to be your primary unit. Your student org is going to be your primary unit. Your classroom is going to be your primary unit, rather than Miami as a whole. Student transition, we need to help you adjust as new students, no doubt about it. We are still going to have welcome weekend programs taking place in August before classes start. We're going to do those remotely. So we're going to have ways for students to connect based on interests and identities and other affinity groups. We're going to have educational programs. We're going to have academic meetings to get you acclimated. We're going to have some social things that are going to be more fun. So we're going to make sure that you still have ways to meet people. And then when you move into the halls in September, we start that again at the hall level. And you're going to be able to meet people in your hall, on your corridor, and be building community that way. There were also questions about dining. Dining will all be open. Now, in that time period from August 10th to September 14th, the only dining on campus that will be open will be in Holy Diner and the Emporium in Armstrong Student Center and Martin Dining Hall on North Quad. So I saw a question about, what about the nursing students? Do you need to move into the halls? We're going to have about 200 students in the halls during the month of August because of their academic program. So as I said, everything is going to be open. It just may be more limited. So we're going to have dining, but fewer spaces. Armstrong Student Center will be open, but reduced hours. So there will be services on campus and support for those 200 students that are here. Then when you get in September, all the dining halls will open. You have to come in with a mask, single file, and instead of the food style where you're taking your food, all of your food will be served to you. You won't get your own fountain drink the way that you did to refill your water bottle. You'll tell them what they want and someone will hand it to you. And then that there is reduced capacity, so you can eat in the facility with fewer students, or you could take it to go. So unlike in the past, If you have swipes at a buffet location, you can get to-go containers that everything will be served to-go in compostable containers so that you could eat on site or take it back to your room or to outdoor seating, whatever is most convenient to you. I'm just looking at my list of questions and notes.
Hey, Jane, this is Amy.
Yeah.
Can I interrupt? So
Yeah.
thank you for all the questions you have already answered. We did have a couple that you've not come to yet that we've been asked multiple times. The first one is, can you please talk about how Miami is making its decision about coming in face-to-face starting mid-September? What are the criteria? By when is the decision being made, and how will that decision be communicated? Thank you.
Okay, that's actually my next slide. So I'm going to do my last bullet here because it's super quick. Visitors to campus. The reason that we are changing our academic calendar the way we did so that you can go home at Thanksgiving and not come back to do your finals is so that we don't have people going all over the country and then coming back. To keep that spirit, we do ask that you don't travel home more than is essential, and that you don't have people coming in from out of town more than is essential. But the more we could keep together as this community in Oxford that is more isolated, the healthier and safer we're going to be. If you do have visitors come into campus, what we're going to ask is that you don't bring them into the residence hall, that you meet with them other places on campus rather than coming into your room. So my last area was looking ahead. We have a lot of people saying, can you promise we're going to come back? Is this actually going to happen? What about the spring? I wish we could promise. I wish that we could predict. But what I can say is everything we've done so far has been a data-driven decision, and that is what we're going to continue to do. That our decisions are 100% based on safety and health. So when we look at September, we're going to need to make a decision in very early September. And what we're going to look at is, how are we doing as a country? Have we gotten it together? Are numbers going down? Are hotspots reducing and new ones are not coming up? How are we doing in Ohio? How is Butler County looking? And how are we doing in Oxford? Have students been in this next phase of returning to campus and they're living off campus? Are we able to have students follow the protocols and do what they need to do? Are we filling up our quarantine and isolation more quickly than we need to, that we think that we won't be able to have enough quarantine or isolation space at the rate that we're going? What is the availability of testing, and how quickly can that testing be turned around? So can we do surveillance testing? Is enough available that we could do that and not have an impact that we're creating a shortage for the communities around us? And can we get a test back fast enough that it is useful in making a decision moving forward? So those are all criteria that we're going to be looking at, are trends, data, and testing to decide, is it safe to bring people back? And that would be our decision point to say that we can come back together or that we need to stay fully online. If we decide to stay online, we've gotten questions, if I choose the face-to-face option and we don't end up coming back face-to-face, could I get the same refund of fees at the same rate as if I chose option 2 right now? And yes, that is true. That is what we would do. We hope that it would be a remote possibility, but there is a possibility that we could come back in September and at the end of October, look at what is happening around the country and say we need to close again like we did in the spring. Or our governor could say, you need to close. We're hoping that that's not true. We're going to do everything we can to be able to come here and stay, but there are things that are out of Miami's control. And some of those things are determined by the illness, some are determined by the Department of Health or by the state, and we all are rolling with this. As I said, none of this is what we want. But if we were to close again, then we would have refunds prorated as we would. And the spring at this point feels so far away. I don't think that we could say anything about where we are. A lot will depend on a vaccine and how we're doing as a country. So that is the last of my agenda. Amy, were there any other questions that were?
Yes. Yes, thank you, Dr. Brownell.
I'm willing to stay a couple minutes if other people are.
A couple of questions that also been consistent. By what date is a flu shot needed? And do students need to try to acquire a flu shot before coming to campus?
No, we know that flu shots may not even really be available very much before you return to campus. It is less of it's not like the meningitis vaccination that you have to upload your documents before you get here. The pledge is saying, I agree that I'll do this. It doesn't have a set date to it. It is saying, when the flu vaccine is available, I will get vaccinated in that period of time. We have 1 million flu clinics on campus. We'll be in Armstrong Student Center. We'll be all over the place. There will be lots of opportunity for you to get a flu vaccine.
Thank you. We've also had a number of people ask if students are required to bring a thermometer with them and what happens for those who aren't able to find one. People express that they're having difficulty.
Well, the good news is we ordered 8,000 thermometers. So it may not be, it's not the big fancy one. It's not the one that you point at your forehead, the other stuff, but you will have a basic thermometer provided to you as an on-campus residential student. You're going to get a kit when you move into the residence halls that will have a Miami branded mask, a disposable mask, a thermometer, and a starter kit of hand sanitizer and wipes. You should certainly be bringing more than that, but we will be having those on hand, knowing that many people will need them.
Great, thank you. We've also been asked what the visitation rules will be in the residence hall. So both we've been asked about if people live within the same hall, can they go from floor to floor to visit each other, as well as off-campus students coming off-campus Oxford students coming onto campus in the residence halls. Is that going to be allowed?
I will tell you that something we're still talking about, because the early recommendations from our work group of faculty, of staff and students that looked at the residence halls has said we are going to ask people to limit their guests, that you should not have an overnight guest in a shared space with someone else, and we don't want anybody to feel the pressure that they can't sleep in their room under these conditions because there's an overnight guest, but that some of this should be determined by the community. So there are going to be conversations for each corridor where some of your understandings are going to be developed together. However, I think where we will probably end up, and I'm sorry that I don't have a set answer on this yet, is we're not going to say it is exactly like it is right now. So right now we are saying you can visit within the building, provided that you do physical distancing and facial coverings, but we are limiting visitors between buildings or from off campus. That is not 100% clear answer. I'm aware of that. I will try to get more clarity, or we will have more clarity in the next couple of weeks.
So Jayne, if I could just share one thought with everyone. There's a lot of questions about, are we going to be policing whether people are wearing masks but with their nose hanging out? And, is Oxford PD going to be giving out tickets? And, all of these nuances. And there are answers to all of these, but at the very base and core of what the message we're trying to get to everyone is that if everyone does the right thing and is as conservative as possible in terms of opportunities of spreading the virus, then we have a much better shot at, first of all, returning to campus, and then second of all, maintaining a presence on campus. If everyone is looking for the, well, this isn't technically required, but I'm going to try to get around it, we are very likely to not be able to have a full on-campus, or what remains of the on-campus experience. So I would just like to encourage everyone to think about, how can you stay safe personally and protect those around you so that we can have a good shot at this.
Thank you. I think that's a great summary.
Yep.
Amy, anything else, or
we did have a couple of people ask how students who, like yourself, might have a symptom that appears to be COVID that is not, what kind of documentation should they bring with them, and to whom should they communicate it?
So the daily symptom assessment is an honor system. Nobody is checking that. So it is you saying, I am not well, and so I'm going to stay home. So certainly our student health service is fantastic. As I said, it's run by TriHealth. They are on the national system. So if you use MyChart at home, they'll have access to all of that. So certainly transfer your medical records or make sure that everything is in MyChart, but nobody is going to come to your room and say, prove that that cough is a chronic cough. It is me doing my daily symptom assessment saying, I know myself, I know what this cough is, or I know that this is allergies, that because every year this week is my bad week for allergies. And so I'm going to go to class knowing I'm not putting other people at risk, or I'm going to stay home because something's off and I don't want to put someone at risk. So it is much more asking you to be aware of your body and what is normal for you and doing what you need to do.
Well, thank you, Dr. Brownell and Dr. Osborne. I think that covers the questions that have been asked that apply to everyone. And
Great.
to let people know, because I know people have also asked, will this recording be available and the slide deck? And it will be available relatively shortly. It'll be made accessible and available to everyone. And Dr. Brownell, I turn it back to you for any closing remarks.
All right, I just want to thank Amy for acting as our host and tech guru, and to Dr. Osborne for joining me tonight, and for all of you for taking the time to be here. If you have additional questions, there are many ways on the Healthy Together website to be able to submit those, or you could always reach out to me personally. And I am just really looking forward to being all together later this semester and hoping that we all can be healthy and well together. So thank you.
Bye, everyone.